Hi everybody, Mike DiFilippo with Overrun Productions. Today I'm going to talk to you about coronavirus and EMS. What is the coronavirus? How can we identify patients that have a potential coronavirus? And how should we respond both on the job and after transferring the patient to the hospital? So coronavirus itself, as the media terms it, is actually more medically appropriately called SARS-CoV-2 or COVID-19, named after the 2019 novel coronavirus. Coronavirus itself is named after a family of viruses that commonly cause illness in both humans and animals. We're more familiar with the coronavirus because it causes the common cold. We have seen more severe illnesses caused by coronaviruses that we are more familiar with called SARS or severe acute respiratory syndrome and MERS called Middle Eastern respiratory syndrome. And this SARS-CoV-2 or COVID-19 is genetically similar to these two diseases and also similar in its severity. So how do these SARS-CoV-2 patients present, and how can we tell that they actually are SARS-CoV-2 versus the common cold or the flu? Well, the major presentations for SARS-CoV-2 are actually pretty vague. It's fever, cough, and shortness of breath. And in severe cases, you'll see more of an ARDS or acute respiratory distress syndrome type picture. Now, as far as who the suspected coronavirus patients are, the CDC has termed them persons under investigations or PUI. And as you can see in the attached image, all these patients have fever or signs of some lower respiratory illness like a cough or shortness of breath. But the big distinguishing factor is the epidemiological risk that's associated with their quote-unquote infection. So this is any person, including healthcare workers, who have had close contact with laboratory-confirmed COVID-19 within the last 14 days, or a history of travel from affected geographic areas within the last 14 days. So close contact is defined as being within 6 feet of a COVID-19 patient for a prolonged period or having direct contact with the infectious disease, as in like a COVID-19 patient coughs directly in your face. Countries that are associated with COVID-19 as of this taping, which is late February 2020, are China, Iran, Italy, Japan, and South Korea. So now that we're at our patient, what do we do next? The first step is to don appropriate PPE, which the current recommendations state gloves, gown, respiratory protection, and eye protection. And if the patient needs it, oxygen mask. If not, a face mask is appropriate. For parts of your assessment, you want to perform them from at least 6 feet away, as this is the quote-unquote danger zone for respiratory transmission. Direct patient contact should be minimized as much as possible to reduce the spread of infection. Now, a word on aerosol-generating procedures such as BVM, CPAP, and BiPAP. Data retrieved from the SARS outbreak recommends against utilization of these procedures unless they're absolutely necessary. These can actually propel viral particles within a local vicinity. If they are used, appropriate equipment should be fitted with high-efficiency particulate air filters. Now, the first thing you want to do when you transport is to notify the receiving facility of a possible SARS-CoV-2 case that's inbound. Family and others who are in close contact with the patient should not be transported with EMS if possible. If they are, they must wear a face mask. The driving compartment should be isolated from the patient treatment compartment, ideally with a Type 1 ambulance and with the interior as shown. Close all doors and windows in the treatment compartment. Last but not least, always wash your hands. What do you do after you've transitioned patient care to the appropriate healthcare facility? Well, the CDC also has guidelines out about this as well. They say to leave the rear doors of the transport ambulance open to allow air exchange and reduction of viral particles, which makes sense. To clean the vehicle with a disposable gown, gloves, and face mask or face shield. And then to utilize hospital-grade disinfectant, which is effective for SARS-CoV-2. Additionally, avoid shaking out any linens, as this may itself propel viral particles throughout the air, and then notify the state or local public health authorities about the potential SARS-CoV-2 case that you just transported. Thanks for your time today, everybody. Again, it was Mike DiFilippo with Overrun Productions. Follow us on Twitter at Overrun EMS, Facebook at The Overrun, and Instagram at Overrun Productions. Stay safe and do better.